Imagine two people walking up the same flight of stairs. One reaches the top talking normally. The other reaches the top with a racing heart and tight chest, fighting for air, though they're not old and not obviously sick. On the outside, nothing looks wrong. Inside, the blood vessels in their lungs are carrying a secret: pulmonary hypertension, high blood pressure in the arteries of the lungs. To understand pulmonary hypertension, let's zoom in on the normal system. Picture your body as a city. The right side of your heart is the delivery truck that sends blood to the lungs to pick up oxygen, while the left side sends that freshly oxygenated blood to the rest of the city. The lung circulation is usually a low-pressure, high-flow highway. Pulmonary arteries are soft, stretchy, and relaxed, so blood flows easily, and the right heart doesn't have to push hard. In medical terms, the mean pulmonary artery pressure is normally less than 20 millimeters of mercury at rest. Pulmonary hypertension means this: the pressure in the lung arteries is abnormally high, and it stays high. By current definitions, pulmonary hypertension is usually diagnosed when that mean pulmonary artery pressure is above 20 millimeters of mercury at rest, measured directly with a thin tube in the heart called a right heart catheter. This is not just a bit of stress or being out of shape. It is a chronic, serious condition that forces the right side of the heart to work far harder than it was built to do. Now imagine those soft, flexible lung arteries starting to change. The inner lining of the vessels, the endothelium, becomes unhealthy. The vessel walls thicken and stiffen. The space inside the vessels, where blood should flow freely, becomes narrower. Chemical signals shift too. The body makes less of the relaxing agents like nitric oxide and prostacyclin, and more of tightening molecules like endothelin. 1. Step by step, the small arteries become a network of stiff, narrowed pipes. Pulmonary vascular resistance rises. The right heart becomes a pump pushing water through a kinked hose. At first, the right ventricle adapts, becoming thicker and stronger, but over time it can stretch, weaken, and fail, leading to right-sided heart failure. Pulmonary hypertension is not a single disorder. It is a final common pathway for different problems. Experts group causes into 5 main categories. First, pulmonary arterial hypertension, where the small lung arteries themselves remodel, narrow, and sometimes nearly close. Causes include unknown factors, genes, connective tissue disease, congenital heart disease, HIV, and certain drugs or toxins. Second, pulmonary hypertension due to left heart disease, where a weak or stiff left heart backs up pressure into the lungs. Third, pulmonary hypertension from lung disease or chronic low oxygen, such as COPD or interstitial lung disease. Fourth, chronic thromboembolic pulmonary hypertension, where old clots physically block or distort arteries. Fifth, rare or unclear mechanisms, including blood disorders, systemic diseases, and metabolic or genetic conditions. The outward story, breathlessness and fatigue, can look similar, but the inner story and treatment needs can be very different, so finding the true cause matters. What does pulmonary hypertension feel like? For many people, it begins quietly. At first, it might be only noticing shortness of breath, walking uphill, or feeling unable to keep up with friends. Then it progresses. Climbing stairs feels like climbing a mountain. The chest feels heavy or tight, heartbeats may race or feel irregular, and lightheadedness or fainting can occur with exertion. As the right heart struggles, fluid can back up, causing swelling in the ankles and legs, a feeling of fullness in the belly, and sometimes a bluish tinge of the lips or fingers when oxygen levels fall. To family and friends, the person may look fine, while inside every simple task becomes an uphill climb. Diagnosing pulmonary hypertension is detective work. It often begins when unexplained breathlessness prompts a doctor to listen or spot signs of right heart strain. Common tools include echocardiography to estimate pulmonary pressures and check right ventricular function, blood tests and lung function studies to search for causes, and CT, or ventilation perfusion scans to look for chronic clots or structural lung problems. But the gold standard to confirm pulmonary hypertension and understand its type is right heart catheterization, where a thin catheter measures pressures directly inside the pulmonary artery. With these numbers, doctors determine if pressure is truly high, where the primary problem lies, and what treatments are safe and effective. Treatment is tailored to the type and cause. There is no single magic pill. Core strategies include treating the underlying cause, supporting the heart with diuretics and supplemental oxygen when needed, and careful management of other health factors. In pulmonary arterial hypertension, specialized medications target the altered vessel biology, drugs that boost the nitric oxide cGMP pathway, endothelin receptor blockers, and prostacyclin analogs or mimetics that relax vessels and limit harmful cell growth. In advanced, treatment-resistant cases, referral to specialized centers for lung transplantation or combined heart-lung transplantation may be considered. Early diagnosis and tailored therapy can improve symptoms and quality of life and slow disease progression. Pulmonary hypertension deserves respect. It is not simply being out of shape or stress. It quietly loads extra work onto the right heart, day after day. Many people are diagnosed late, after years of subtle symptoms. But with growing awareness, better imaging, and targeted therapies, more cases are being caught earlier and treated more intelligently. Pulmonary hypertension may be measured in pressures and resistances, but in real life, it is about the pressure of climbing stairs and feeling older than your years, about explaining breathlessness when nothing looks wrong, and about the steady burden your heart bears every beat. Naming this invisible pressure is the first step toward measuring, treating, and taking control back from the disease.